Welcome. I am live, Dr. Anthony Youn, America's Holistic Beauty Doc, and today we are going to go over facial fillers. Now, a couple of years ago, on my first live social media broadcast ever, I did a segment on facial fillers, and just on YouTube alone, we've had over 250,000 views on it. Crazy. So many people have watched it. So that's been a couple of years old, and people are still watching it. So I thought, this would be a good time for me to update it because there's so much more out there with facial fillers. So just as an introduction, if you're wondering, is Botox a facial filler? The answer is no. There are two main types of injectable treatments today: neurotoxins like Botox and Dysport, and facial fillers. Neurotoxins are used to basically weaken muscles that create wrinkles, muscles like the glabella. And you can see I've had a little bit of Botox here in the past, which has caused me not to be able to create those deep 11 signs that I could in the past. Forehead wrinkles, as well as crow's feet wrinkles, these are typically best treated with a neurotoxin like Botox or like Dysport. Fillers are used to fill in lines or wrinkles or plump areas up. And the way I describe it to my patients, it's like liquid skin. You inject it into areas that you want to plump up. Now, the original filler was collagen. And back, now a couple decades ago, collagen was very popular as a way to fill in lines. Well, the newest fillers are typically hyaluronic acid based. And these are much better than the old collagen because they last longer and they are reversible. Okay, and so if you inject the hyaluronic acid substance into, let's say, a part that you don't like, or you get a lump from it, or God forbid, it goes into a blood vessel, you can inject hyaluronidase, which is basically an antidote to it, that will melt it away. And that's a super important reason why, if you're going to get facial injectables, go with the hyaluronic acid-based injectable. With one exception, and I'll go over that here in just a little bit, because the hyaluronic acid fillers are going to be the safest. So what I'm going to do on this video is just go from the top down, okay? Because I get so many questions of, okay, what do I fill my nasolabial folds with? What's best for the cheeks? What's best for the temples? Every doctor has their own opinion, and I'm not going to tell you that my opinion is the best for everybody, but I'll give you my opinion in this video so that you know that if you're going to have an injection, what I recommend, talk with your doctor and see if that doctor recommends the same thing. So once again, if you're looking at forehead wrinkles, if you're looking at wrinkles of the glabella or the crow's feet, Botox is the way to go. Okay, Dysport is an alternative version by the makers of Restylane. That's a very good treatment as well, but that's what I would recommend first for those lines. And hopefully coming out very soon is the newest Botox competitor called Jeuveau. Jeuveau is something that has been in the pipeline for many, many years, and I'm really excited for that to come out. And by the time you watch this video, it might be out and might be rocking and rolling. People may be really enjoying the results from Jeuveau. But as of this video, Botox and Dysport right now are what is available for these lines up through here. As we go down the face, okay, super common question, what do I do to fill in my under eye hollows? We get this question all the time. So I have got all of my boxes here of all the different fillers that we do here at Youn Plastic Surgery. So I'm going to go over what I recommend for these specific areas so that you know what is best for you. So if you're looking at under eye hollows, the filler that I recommend for that is Restylane L. Okay, Restylane L is Restylane with lidocaine. This is once again a hyaluronic acid filler. If you're injecting under the eyes, ideally you want your doctor to inject small amounts. Usually if you have one syringe of Restylane, a 1 cc syringe, that's more than enough to fill the under eye hollows. So like 0.4 cc's on each side is usually enough for most people. The risk of getting the under eyes filled is lumpiness, okay? So you have to be very careful. There are certain fillers I don't recommend under the eyes. This is the one. If you go for anything, go with the traditional Restylane L for the under eyes. And like I said, the reason why I recommend that is because it has a lower risk of lumpiness, unlike some of the other fillers that may absorb moisture and plump up after you inject it. Restylane L does seem to stay about what you see. So what you see is going to be what you're going to get. And unlike if you inject it into the lips, if you inject it under the eyes, it can get pretty darn good longevity. Some people get over a year when it's injected under the eyes. All right, well, how about, let's go up a little bit, actually, I forgot, the temples. This is an area that a lot of people forget about when they're looking at injectable fillers. But the temples are an area that really can thin in so many of us as we get older. And it's an area that a lot of us don't really realize. I get so many people that come in to see me and they say, yeah, there's something about my face. I feel like my face is too thin, but I don't know where to fill. And quite often it's temporal wasting, where this area gets thinner and thinner and thinner. So what I recommend for that, which is the easiest, is Sculptra. Now, I mentioned earlier that hyaluronic acid fillers are the ones that I typically recommend for most of my patients. The only non-hyaluronic acid filler that I recommend is Sculptra. Sculptra is poly-L-lactic acid, as you can see. And this is basically, it's like a powder that you mix with water. You inject that mixture into areas of the face. And what it does is for a day or two, that water may stick around and then the water dissolves away. And the Sculptra powder that is left under the surface will interact with the surrounding tissues to increase the collagen content and to gradually fill that area out. The negative with Sculptra is it does typically take 2 to 3 treatments for maximal effect. The positive of Sculptra, though, is that results can last 2 years or even longer. And for those people who really want a very gradual change, Sculptra can get that for you. The reason why I feel Sculptra in general is safe compared to some of the other non-hyaluronic acid fillers is because it's injected in a very dilute fashion. Okay, it's kind of like if you're mixing Kool-Aid. Kool-Aid, mixing that is still a liquid, okay? And even if it's accidentally injected into a blood vessel, the risk of it clogging that blood vessel is lower than if you get some of these other thicker fillers that are accidentally injected. So if you're looking at the temples, Sculptra is a very good treatment. Literally, it's one poke, and what we do is we make one poke go all the way down to the bone, believe it or not. Don't worry, it won't go into your brain because there's bone in the way. And we inject it very deep right on top of the bone below the muscle in the temple area. And that helps to gradually fill that area out. Now, you could consider a different type of a filler. Restylane, like I mentioned earlier, that could also be used in the temple area. You could also use a filler like standard Juvederm. And where is it? Here it is. Juvederm Ultra Plus. This can also be used in the temple area as well. I'm not as big of a fan with the hyaluronic acid fillers in the temple just because there's a big blood vessel that comes right through that area. And I just don't want there to be any chance that we could accidentally inject the filler into that blood vessel. And so for that reason, for the temple, for most of my patients, I recommend Sculptra. Once again, we'll need, though, typically 3 treatments to get maximal effect, sometimes more, sometimes less. All right, what about the cheeks? The cheeks are a very popular area to inject. I love injecting the cheeks because one of the areas of our face that loses volume, really the main area, in my opinion, that loses volume that can really benefit from it as we get older are the cheeks. And when I first started my practice back in 2004, the only real good filler we had at that time was fat. And I did a lot of fat grafting in the first 10 years of my practice. But now that we've gotten a number of injectable fillers that are FDA approved for the cheeks, I'm doing a lot less fat grafting than before. Now, my top choice typically for injecting the cheeks is Juvederm Voluma. Now, Juvederm Voluma is a nice filler in that it's very similar to regular Juvederm. It has a different type of a cross-linking pattern to it. And the great thing about Juvederm Voluma is that it lasts a long time. You can get upwards of 2 years, usually 1.5 to 2 years with Juvederm Voluma. So the Voluma is what I typically recommend for plumping up the cheeks because you get such good longevity from it. The negative of Voluma, it's a bit more expensive than the other fillers. And some people who are a bit on a budget may opt for the Restylane version, which is Restylane Lift. Restylane Lift is another very good filler. It is FDA approved for the mid-face, basically to plump up the cheeks. The benefit of Restylane Lift over Voluma is that it is less expensive. The negative is I don't think it lasts quite as long. So if you're thinking about having your cheeks injected and you're not sure that you're going to like it, maybe best to go with Restylane Lift as a way to try it out. If you like it and you want something longer lasting, then you may want to try graduating to the voluma. A final option, if you don't want to spend a lot of money at one time, here's my green drink, is Sculptra. Sculptra is a great filler for the cheeks as well. This I use quite often in the cheeks for people who say, look, I don't have the budget to spend on, let's say, 2 syringes of voluma or 2 syringes of lift, but I can spend less each time and come back a couple of times to do Sculptra. So you can definitely use Sculptra for the cheeks. I think it's a very good filler for the cheeks. It just takes longer because typically you need, once again, 3 treatments, maybe more, maybe less. We space those out every really 6 to 8 weeks or so. And so for those people who are okay with the gradual filling out, then Sculptra is a way to have that done. You spend less each time. Maybe instead of spending $2,000 in one shot, you spend $500, but you do it 3 or 4 times. So that's another option. All right. As we go down the face, nasolabial folds, these are the most popular areas to inject. The nasolabial folds are these static lines that go from the corner of the nose to the corner of the mouth. And the majority of injectable fillers are FDA approved for that area, but not all of them are the best for that area. So let me show you what I recommend, excuse me, for the nasolabial folds. Juvederm Ultra Plus, this is a workhorse for the nasolabial folds. And the reason why I like this is because it has good longevity. It can last a good year or so. It's a very nice and easy injection, and it's very moldable. So you can massage it at the time of the treatment to reduce any, let's say, potential lumps and that type of thing. A great filler. You can use Juvederm Ultra Plus in so many different parts of the face. The only place that I recommend you definitely not have it injected is under the eyes. But otherwise, you can use it off-label, technically for the cheeks, for the lips, and that type of thing too. But what I recommend as far as nasolabial folds, this is a great filler for that. Juvederm recently released Volbella, Juvederm Volbella, another great filler for the nasolabial folds. I would use Volbella in a patient where the folds aren't quite as deep. I would use Ultra Plus in a patient where the folds are deeper, okay? Because I do believe that Juvederm Ultra Plus has a bit more of a lifting capacity than Volbella. Volbella is a bit of a softer injection, so something where the folds are a little bit softer, they want something a little more moldable, a little less stiff, then Volbella may be a better option. But if you've got a deep nasolabial fold, you want to consider Ultra Plus. Well, what else can you use? Restylane Define. This is one of the newest Restylane products, a very, very popular product in our office. Restylane Define was originally used in Europe and still is under a different name called Emervel. And what this is specifically made to actually inject into parts of the face that move, because the filler will actually move with the parts of the face. One of the things that a lot of people are concerned if they have injectable fillers is getting, let's say, a stiff appearance afterwards, you know. So if you have the nasolabial folds done, it looking and feeling stiff. And fillers like Restylane Define and its cousin, or brother or sister Refine, are used basically to inject into those areas and allow those areas to still look and feel soft and mobile. So this is another great one for the nasolabial folds. Probably not my top choice if the folds are really, really deep, but if they're not that deep, this or Volure, I think, are fairly similar products. I like both of them a lot. If it's a stiff fold, though, if it's a real deep one, then once again, Ultra Plus is good. And then I should also mention you can use Restylane Lift in the nasolabial folds as well. So if you've got deep folds, Restylane Lift is a great filler for those deep folds as well. All right, how about the lips? The lips are super popular to inject, and unfortunately, people are having them injected too much, as you can probably see in photos and videos from people out in Hollywood. So there are a lot of fillers, once again, that you can use for the lips. Let me show you the workhorses. Juvederm Ultra Plus, we use this in the lips all the time. This gives a really nice plumping effect to the lips, and it lasts a good amount of time, 6 to 12 months or so, typically. The positive of this, once again, it's a powerful lifter, so you can really fill the lips out nicely. It does a really good job with outlining the lips, and it lasts quite a bit of time. The negative is you may get a little more of a dramatic result with this. Okay, so if you're looking for a softer result, you can consider Juvederm Volbella. Juvederm Volbella is a softer filler that is FDA approved for injection around the lips. And so this is a much softer filler, similar to like a velour, but this one's made specifically for the lips. Lasts anywhere from 6 to 12 months as well. Once again, giving a bit of a softer look. If you're looking for a real pouty, more of a dramatic appearance, this may not be the best one for it. But if you're looking for just a modest kind of a soft change and filling out, then Volbella may be a really good one for you. Another one is Restylane Silk. This also is FDA approved for the lips and is a great filler for filling out the lips. And another one is Restylane Refine. Restylane Refine is the cousin, brother, sister, whatever you want to call it, to Restylane Define. This does not quite have the lifting ability of Define. It is softer. It is, once again, mobile, a really nice filler for the lips. The only question is, does Refine and Volbella, which are the two really soft fillers, do they last as long as Juvederm Ultra Plus or Restylane Define? Maybe not. We do see some patients where they do seem to disappear a little bit more quickly. That may be a bit of the negative of going with the softer, less, once again, dramatic, powerful lifters for the lips. So you got a lot of options for the lips. Honestly, with the lips, you can do once again, Silk. You could do Juvederm Ultra Plus. You could do Restylane Refine and Volbella. Those are all very reasonable options for the lips. If you're going to have it done, really talk with your plastic surgeon or your dermatologist to get their opinion on what would work best for your lips. And a lot of it comes down to what your expectations are. All right, well, what else? We've got fine lines around the mouth. These are really, really hard to treat because in so many people, these smokers' lines are so fine that it's hard to get a filler, an actual needle to inject and fill them. But if they're deep enough, then what I recommend for those types of lines are Restylane Refine, okay, because it's very soft. You can inject it into these tiny little wrinkles. Another one that's really good for that is Volbella, okay, once again, very fine filler. If it's slightly deeper, then I find Restylane Silk is another option as well. So those are the three that I would do for the lines around the lips. Would be Restylane Silk, once again, Juvederm Volbella, and Restylane Refine. And then marionette lines are another area very commonly treated. It would be the same things that I would recommend for that as we do for the lines around the mouth. So once again, it would be the Restylane Silk, the Juvederm Volbella, and the Restylane Refine. Depending on how deep those lines are, sometimes you may need something a little bit stronger, in which case the Restylane Define is usually what I recommend for that. Or you could even consider a Juvederm Velour. Once again, a softer filler, a filler that is more moldable. It tends to move with the surrounding facial structures. Finally, I've had a lot of people that have come in to have their chin injected. Once again, when I started my practice back in 2004, I did a lot of chin implants. We did fat to the cheeks, chin implants to fill out the chin. And nowadays, I'm doing a lot less of that because we can do injectable fillers. So very commonly, I use a filler like Restylane Lift for the actual chin. And it's a good filler. I inject it right on top of the bone, underneath the muscle to enhance the chin. And it's a very, very nice treatment for that. So these are the variety of different fillers for all the parts of the face. I hope this has been helpful for you. Remember, if you're going to have fillers, what I recommend, Dr. Youn, the Holistic Beauty Doc, recommends is a hyaluronic acid filler overall. The only non-hyaluronic acid filler other than fat that I recommend is Sculptra. And I think Sculptra is great for the temples and for the cheeks. Do not inject it around the mouth, however. Okay, cheeks and temples, Sculptra, and the cheek hollows, Sculptra, I think, works very, very nicely. A couple other things to keep in mind. The number one complication we want to avoid is intravascular injection of the filler. That's why you do really want to be choosy on who does this. Even if they use a hyaluronic acid filler, the worst thing that can happen is it's accidentally injected into a blood vessel. And there are blood vessels that go all up like that into our face. That can cause horrible, horrible complications. ranging from scarring to, believe it or not, even blindness. So having an injectable, an injector that is very experienced, that has the backing or is a board certified plastic surgeon or dermatologist is super important. Make sure it's a hyaluronic acid filler. Make sure they have hyaluronidase available. Hyaluronidase is the antidote. There's no point in having an antidote available and not having it there, okay? Because a lot of times you want to have this injected right away if that complication happens. So ask your doctor, do you have hyaluronidase available if something, if something bad happens? And then finally, one thing that I recommend for all my patients whenever possible is that we use a cannula. Cannulas are long, blunt needles that we inject the fillers with. It costs us a little extra. It's not a guarantee that you won't get into a blood vessel with it, but it lowers the risk of that happening. And so all of my injectors here at YPS, myself, we use cannulas whenever possible, which is probably realistically 80+% of the time. Sometimes you get, let's say, little lines here or the mouth lines, you can't inject that with a cannula. But most areas like the cheeks, like the cheek hollows, like even the lips, we can inject most of that with a cannula for optimal safety. So I hope this was helpful for you. My name is Dr. Anthony Youn, America's Holistic Beauty Doc. Thank you so much for watching. Any questions, leave them here, and I will try to answer them when I get a chance. Thank you very much, everybody.